Late Night Health continues. As we wrap up our show today, we're spending some time with regular contributor Dr. Greg Celaya, and we're talking about when to use natural health care versus traditional or allopathic health care. Even going to a doctor for a blood test, something that you've been trying to get me to do for 3 months now. Is that even different?
Well, we may run some of the same tests, but there's a lot of tests that we run completely different. And we look at them different as well. We can talk about how they basically look at the test and determine the lab value normal. But yeah, we do look at them a little bit different because we're looking for different purposes.
What's that purpose?
Well, we want to see everything that we can imagine what's going on with the body as a whole, not just necessarily as a piece. So, they may look at it as, gee, you're just a liver or, a lung, but we want to see the entire picture, to see the entire system.
We have categories that we stick doctors and guests in. One is alternative, one is traditional,
sure,
and one is integrative.
Sure.
Isn't that to me, that seems to be a more logical approach to healthcare? Yeah,
you know what? It is, because basically they've gone to specializing so much in one thing, that they're forgetting to treat the rest of the body. And so when you start getting to alternative and integrative, then it makes a big difference because you're now looking at everything, not just one piece. Don't get me wrong. I think medicine has its place because we wouldn't be here right now without it. You have an injury. I think cancer is definitely something to concern with normal medical care as well. Stuff that happens fast, that needs fast treatment. Antibiotics, they're wonderful at a price.
At a price, of course. And at the same, what about, a heart attack?
Well, the whole, yeah, absolutely.
We want to prevent that.
The prevention is the key. And so waiting till the last minute till you have it, you have no choice but to go to the emergency room and to go through that program. It's phenomenal. It saves lives every single day. But the secret is don't get to that point.
Right. Do you find that most men in your practice, patients who come in to see you, are afraid, because this is what you said to me the other day, of results that they're going to find from a variety of testing?
What I see that not just from men, but from women as well. But what I do see from men is men wait till they're darn near dead to try and do something about it. And at that point, it might be too late. I think that might have something to do with perhaps maybe why more men die from heart attacks than women.
Though women are close behind right now.
Yeah, they are. But, they're a little bit smarter when it comes to their body. Men are we're kind of dumb. We've got this mantra thing going on. We don't ask for directions. The same with our health care, right? It's just inborn. It's instinct with us.
There's the title of the book.
There you have.
Right? Directions to your body.
Yeah. Oh, I like it.
For men. I like that.
I like it. But the problem is men won't read the books.
No, but their wives will, and then they'll make them go and do whatever the book says. So
yeah,
that's okay.
Yeah.
Right?
Yeah.
Has traditional medicine, because you work with MDs all the time. All the time. Have they been more accepting, do you think, of alternative health in recent years?
Oh, absolutely, because they're seeing this stuff working. When we go through and we look at biochemistry down to the cell level and we understand what's happening, some of them don't necessarily get even to that point. And so it does make a big difference, and they're seeing progress. So, yeah, it's very, very well accepted, and it's just getting more and more and more.
Is that primarily with younger docs or the whole industry?
I would say you're right, the younger docs, because they're becoming more educated, whereas some of the old, whatever they learned back in the 50s is what's gospel at this point.
Exactly. When you go in and talk to an older doc, I'd like them to be open to supplements and,
sure,
and even massage therapy. I've been told that massage therapy does nothing, and I know that it does make me feel good. So it has to be releasing some brain to make me feel good.
Yeah, it definitely has a benefit.
Exactly. Dr. Greg Celaya, and by the way, visit his cookies, glutenfreecookies.com. Glutenfreecookies.com. They're delicious. They really are. You're welcome. Thank you, Greg, and we look forward to talking to you again very soon.
We'll talk to you guys soon.
Okay, thank you. I'm Mark Alyn, and we thank you for joining us. If you would like to suggest a topic, write a blog, or even just say hey, go to latenighthealth.com and you can leave us a message at info@latenighthealth.com. I'm Mark Alyn for the Insane Daryl Wayne. Have a great week. Have a good week. Have a healthy week. We'll see you next time.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.